So greetings and a warm welcome to everyone. I'm Sravshi, the asset moderator from CLIRNET. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us from across the country. We are indeed fortunate to have the valuable support of esteemed doctors, and I express my gratitude to each one of you for dedicating your time to be with us today. Allow me a moment to introduce our platform CLIRNET. It stands as one of the largest live digital semi platforms in India, providing a space for doctors to create and share medical content. Now, I would like to extend a special welcome to today's distinguished speaker, Dr. Niraj Pandit, sir. Sir holds degrees in MBBS, MD, AFIH. He is professor and head of the Department of Community Medicine at SBK's Medical Institute and Research Center, Sumandip Vidyapith, Piparia, Vadodara. Once again, I welcome all of you at this lecture for the topic, Role of Telemedicine in Public Health. So without any further delay, sir, I would like to hand over the session to you. Over to you, sir. Kindly present.
Yeah. Okay, slides are visible, I think.
Yes, sir. Yeah.
Okay. Okay, good afternoon, and thank you giving the opportunity to CLIRNET. This is the second session I'm taking on the telemedicine role in public health. Today we are going to discuss on the public health related telemedicine. How can we expand our services of telemedicine and improve the public health services in community. Okay, so this sessions include, I'm trying to cover the objectives of this session. Public health, we will first try to understand what is public health, why it is important, current practice of telemedicine in public health. We will try to understand what are the current practices, and then we will see the scope and opportunity with a few examples. You can use, you can plan, or you can, if you have not tried, you can try it for your practice also. So these are the public health opportunities for in telemedicine. So what is the public health? First, we need to understand public health defined by the World Health Organization, the art and science of preventing disease, prolonging life, and promoting health through the organized effort of the society. This is very important. Ultimate aim of the public health is the preventing disease, prolonging life, and promoting health through the organized efforts of the community and society. So society, or you can say a nation, or you can say a world, is always trying to improve the situation in life so that disease can be prevented, prolong the life, that is healthy life, happy life, and promote the health. So these are the three components of the public health, and this all component we are achieving through the organized efforts, and that efforts at the level of the state government, at the level of the national government, and at the level of the world by the different government together under the umbrella of World Health Organization and United Nations like organization. Public health is also defined as a science of protecting the safety and improving the health of communities through the education, policy making, research for disease and injury prevention. So this, keep in mind, it's again same thing of protecting the safety and improving the health of the community through the education, policy making, research and disease and injury prevention. So this is the basic concept of the public health. Now, what are the things under head of the public health people are doing? See, these are the basically various role of public health. Monitor the health status of community to identify the potential problem. See, this is the first important step, or you can say a public health action, is they are monitoring the health status, continuously monitoring the health status of the community. You know, country like India and other country, they have a regular data collection system for the various system. If you know the National Family Health Survey, we are doing regularly this every 5 years, sometime every 4 years, sometime maybe delayed, but we are doing a various National Family Health Service, SRS sample registry system. These are the various way of conducting monitoring the health status of the community. We are trying to understand what is going on in the community. Other than this, all this primary healthcare system, we are regularly collecting data at the village level by the you can say ASA and ANM worker. They're collecting the data from their subcenter and villages. This subcenter and villages data compiled at the level of the PHC. PHC data compiled at the level of the uh, district, taluka, and then district, and then state, and then the nationwide. So based on this, approach is known as a bottom-up approach. All the data coming from the remote most village reach to the state, and state to the national government, and based on this, they are doing a planning for the next upcoming year. Second is the diagnosis and investigation the health problem and hazards in the community. They are doing the diagnosis and investigation. Anything unusual, they always try to diagnose, reach to the reason why that happened. Any epidemic, they are trying to investigate, diagnose, control, and action, prevention for the future, such type of the epidemic. Inform, educate, empower people about the health issue, particularly underserved and those at risk. See, this is a very important task of the public health. We have to inform, educate, and empower people to take a decision. So continuously, public health system is giving the various IEC information, education, communication material to the community, and they try to make a behavior change. And this behavior change help to improve their health. And this is particularly role of the public health people to underserved and those at the risk. Mobilize community partnership to identify and solve the health problem. See, this is very important. Identify the problem at the locally and try to get the solution at the local. And this is the beauty of the public health. The local level community supported by this technical expert people, ANM, ASA, you can say they are from the community. Then you can say a doctor, medical officer having the knowledge of the health and medical science, and they identify the problem and then solve the problem. Develop the policy and plans that support the individual and community health efforts. Here this is the level of the state government, national level. They're defining the policy and plan and support individual and community to improve the health. Enforce law and regulation. Wherever required, they make, when there is ethically not solve the problem, they make a law and regulation to protect the health and ensure the safety. In COVID, the country, biggest, world's largest country, and that lockdown. And this is very important, enforcement of the law. And the whole system stands in for the 3 months. And that is really a challenge. And government had a challenge, they overcome with the law. Link people to the needed personal health service and ensure the provision of the healthcare when otherwise unavailable. This is very important aspect of the public health. This is the responsibility of the government to reach the remotest place, remotest the village, remotest the person living and provide the health care. And that insurance government has to give. And this is the role of the government. So this is very important aspect of the public health. Ensure a competent public health and personal health care workforce. That is also very important. We government need to create a public health cadre. And that is a very important task of this public health. Evaluate effectiveness, accessibility, quality of the personal and population-based health services. This is continuous ongoing process. How to improve? They are try to evaluate the effectiveness, accessibility, and quality of the services and try to improve. Research, new insight, innovation, solution to the health problem. These are all the functions of the public health. And now we will see how this public health functions incorporated with the telehealth, and you can say a telepublic health, and how best can be used in the future. What are the current models available and government is following? See, current use of telehealth in public health. IMTECO, if you recall, this is a very important initiative taken by, this was the model initiative taken by the Seva Rural Jagadia. If you know what, there is a very important NGO working Seva Rural Jagadia, that is in the Bharuch district, Jagadia Taluka, and they are providing services to the community since almost 35 to 40 years in this area, tribal community, and they took an initiative, mobile-based initiative. It's a joint initiative of the Seva Rural and Department of Health and Family. It is known as IMTECO, Innovative Mobile Phone Technology for Community Health Operation. This was the first they took initiative, and this initiative was successfully implemented later on in Government of Gujarat Health System. It is a mobile phone. If you see, if you write in the YouTube or you can Google IMTECO, you will get a lot of literature that is published article also. And not only published article, you will get a videos also, how they are functioning at the level of the community. They included various technology-based job aid to facilitate the scheduling of home visit, screening for the complication, counseling during the home visit, and supportive supervision by the PH staff. So they have made one application, install that application into the mobile phone of the worker, ASHA, that is the village level health worker, and they trained them. And this was almost, you can say, in 2015-16, they launched this project. Initially, I was just small part of this project. I know how they implemented. They did this implementation. There are a lot of challenges. Use of the mobile technology by the ASA worker, that was the most challenging during that time. Post-COVID, we are really lucky. Everybody using the mobile, but during that time, pre-COVID era, the use of the mobile, and that too, that is a job. They have to enter the data also. They have to facilitate the scheduling, home visit, kab jana hai, kiske ghar jana hai. That everything is given on the task base. Screening up for the complication. This is basically focused on the maternal health and child health. They are trying to focus home visit, counseling for the anemia and other high risk pregnancy. Sickle cell was the problem during that time in their area. They are taking care of this. So this all thing with the government staff, and this is very important. They tried to implement this system with the government staff and successfully implemented. Based on their experience, the government of Gujarat expanded in all over the Gujarat. Now, recently in last, I think 6 months or 1 year, they have expanded. They are expanding to the Uttar Pradesh and other state also. So this is very interesting example of use of the telehealth in public health. So this need to be understood. Now, see, government has improved. It's the next IMTECO updated to TECO Plus. In TECO Plus, they are taking a more information and completely mobile based. Whole maternal and child health are MCH program, RCH program. They tried to collect everything in the mobile. So the mobile based monitoring, supervision, activity, they have a IC material also, videos are also available in that particular application. So they can do all things with the help of the TECO. So geographical tracking, GIS location of the various type of the patient, you can say a hypertensive patient, diabetes patient, you can even locate the ANC, tuberculosis, all together you can use this in particularly TECO. TECO is very important initiative of government of Gujarat. You can learn this in the various video available online. So this is a first example, telehealth. See the second, epidemiological surveillance. And this is known to all of us. We all know, we already use this part, epidemiological survey in COVID. COVID, what we did everything online. Patient tracking system, triage, everything we did in the COVID on the, you can say a use of telemedicine. See, there are many patients. There are various models that time popular. And when the patient registering with the hospital is providing the kit with the, you can say a mobile number, application, then you have a oximeter available, few drugs, BP monitoring, you can say if you require the glucose monitoring, this kit is coming to your home, and you can daily update your status to your family doctor. So this is implemented by the various hospitals in the various cities. And not only that, government also implemented. Government also implemented through the PHC, CHC or urban health center at the various level. And they also tried to contact their patient and minimize the load to the hospital. No need to rush. They are only saying that no need to rush to the hospital in each and every case. Wait, consult your family physician, consult your PHC medical officer. If they suggest based on their various parameter, they will ask you to visit the hospital. Still, because of the so many anxious patients are there, relatives are there, they rushed and we could not able to manage. But still, many people tried at the various level. And that is a COVID. We learned how we can do the epidemiological surveillance. You also know IDSP program, that is Integrated Disease Surveillance Program. This was the program launched in Gujarat first post-earthquake of Kutch earthquake in 2001. And that was the first initiation of tracking epidemiological surveillance of earthquake prone area, earthquake for post-disaster area. So we will see the disaster also one of the important requirement where you can do the things and you can do the use of the telemedicine. So here what we are doing at currently all PHC, CHC, district hospital and the medical officer, medical colleges, everybody is reporting their data to the IDSP and they are reaching to the state and national level. And based on this data, they are doing the forecasting, epidemic forecasting. And epidemic forecasting is very important model we need to understand. And this proper, for that you require a proper data. So this is another way of telehealth. You can say a telepublic health. You can forecast the thing, you can prevent the things. And this is a very important part of the epidemiological surveillance. Identify the high risk population. Based on this, you can say that this population at risk. So there are various data they are collecting along with the disease. They are also collecting the data of rainfall, heat, and based on this, they are doing the forecasting of the disease. See, currently the Gujarat and many other part of the Bharat facing a very severe heat. You can say red alert, yellow alert. So in this, when temperature is crossing 41 degree, 42 degree, 43, 45 degree. Recently, yesterday in Maharashtra, Bhusawal area, 45 plus degree temperature. So it's a really red alert for the population. Identify the high risk population. See what will happen. You can immediately use. Nobody can rush to the hospital in this scenario. You can contact your family physician, doctor through the telemedicine and try to get the benefit. Okay. So what we are doing indirectly contacting all the clients and giving the advice, be at the home between the 11 to the 4 p.m. Don't go unnecessarily outside in the heat. And this is the way you can focus on the high risk population and minimize the risk. You can even use the GIS, that's a geographical information system, and find out the various strata, see the water collection, mosquito density is there or not, malaria forecasting, dengue forecasting, heat-related forecasting. This all forecasting related, and you can use this similar way in the public health. Pollen-based forecast. This is very important. People are trying to make a which area having which type of the pollen or allergens available and how you can prevent this asthma like allergic disease. So this is the epidemiological surveillance you can continuously do, and you can use this surveillance for the making community healthy. So this is something about the epidemiological surveillance in public health. Then the disaster management. Telemedicine disaster management, it is very popular. NASA used first-time telemedicine in Mexico earthquake in 1985, and reports are available online. You can see how NASA used. Previously, for the telemedicine, the role of ISRO, NASA was very popular because we need to take a help of the satellites. But after coming this particular mobile phone and various application, the requirement is very easy to set up. Telemedicine setup is very easy to put at any place. So telemedicine can be integrated in all phases of the disaster. See, during the preparatory phase, you need to install the technology. You need to do the setup. and training of risk assessment to your staff. So that is the preparatory phase. When to use, how to use if disaster mitigate. During disaster, tracking, risk assessment, surveillance, action to prevent the epidemic. Because during disaster, flood is there, you can see it's something 1 or 2 day. You can need to track your human being, where they are, animals, risk assessment. You can try to assess where the maximum risk is there, what is happening, earthquake, what are the center of the earthquake. These are the all things during the disaster you can use. And post-disaster relief, very important. You need to go on the ground. Ground and triage, we are doing the triage. But triage followed by the team coming to take care. And that is very important. The team need to be understand ABCD, that is emergency. It's a who are required emergency services. And if we use an electronic tag that with the location, our medical team directly reach to the particular place and they give a help to the emergency services. So this electronic tagging system with location will help to track this. Telemonitoring, you can monitor what is going on. Post disaster, there are very high chances to get a various epidemic. So with this telemonitoring, you can monitor the situation continuously. You can collect the data and monitor what is going on. Mobile field based hospital, you can create immediate hospital in the van and the hospital can provide the primary care. Mobile OPD and vaccination, very important. Post disaster, many times we are forgetting the vaccination. We should not forget the vaccination. And vaccination to the children and mother is very important. Maternal and child health care, we should not forget post disaster. And here, telemedicine will provide the best solution. Mobile ICU, you can give the immediate services. Mobile ICU, you can say OT and on-site immediate operation, and that can be done. Telediagnosis, teleconsultation, clinical decision support system, epidemic warning, all this post-disaster we can use in any man-made or you can say a natural disaster following use of it. Because in disaster, local system is overburdened. They are not able to cope up the situation. In this case, the remote people sitting, those who are outside from the disaster area, they can provide the help with the help of the telemedicine. And that is the best model I think we should take care in the future. If there is a disaster in Gujarat, Maharashtra, Rajasthan people sitting there, medical college, they can help to Gujarat. Something like. So the remote people, and not only that in the Gujarat and within India, you can say even help to the outside India. If there is a disaster somewhere outside in the African countries or even in the European countries, India can support with the help of the telemedicine. So that is the biggest opportunity of the telemedicine in disaster. So this is something about the three model I have discussed in this particularly. Now we see what are the scope and opportunity of telemedicine in public health. See, first is teleconsultation. Tele-OPD for the primary care linked to the hospital. See, this is a very important upcoming opportunity. See, government is establishing new medical. It is said that we are going to produce 1 lakh doctor per year in near future, 1 or 2 years. But still you can see a remote places like tribal, like rural area, doctor availability is the issue. They are not available. So in this scenario, how we can provide the best services? See, Sumandi Vidyapit took an initiative and we are doing our own Arogya Rath in 64 villages. Every day, 3 villages we are covering. Monthly fixed day OPD we are running, but still we are missing this tele component. So we are trying to see, because requirement of the OPD is a daily affair. It is not once in a month. So we are trying to think about to establish a small center in the each village with mobile application and that link to our hospital. Our hospital OPD based on the tele OPD, we will sit here and provide the required treatment in the villages in emergency as well as you can say a routine OPD and follow-up also. So this is the first important teleconsultation because small villages, see our villages are so small. They have a just 50 to 100 houses. That means you can say a 300 to 500 people living. And they are also scattered. Reaching to the from that village, reaching to the nearest hospital, they have to travel at least 5 to 10 kilometers, which is not easy. In this scenario, teleconsultation, tele-OPD is the best solution. So we are trying to find out the best solution, and even other colleges also can do, even as an individual can plan this.
Sir, you are muted. Kindly unmute, sir. Hello, sir. Sir, you are muted, sir.
Now it is audible.
Yes, yes, yes.
Yeah,
Continue, sir.
sorry. It was a interruption because of the electricity.
Okay, not an issue.
Now come to the tele-education. We can create a new cadre of the health staff. This is very important. New cadre of the health staff with the new skills. We do not require now simple health staff. We need a health staff with a knowledge of the tele-education, telemedicine, how to handle the mobile, how to use the application. Everybody is now with their training they can use, but we need to incorporate in our curriculum. So keep in mind, this incorporation of the curriculum is very important. Telemedicine in rural and remote area, real-time data management and supply of the essential item. Don't forget, because drugs, dressing material and other supply of the essential item is also very important. So these are the scope. You can see India is a wide geographical area. It is not easy. With 1.4, now it is said 1.45. Oh, sorry again.
Sir, please share the PPT. Yes, yes, yes. Continue, sir.
Yes. Again, sorry. AI-based powered telemedicine tools are available now. Self-diagnosis. See, this is a simple self-diagnosis tools for your physical health. You can scan it and see what is your physical health based on the scoring. Now there are very many scoring system upcoming in the system. Wearable technology links are available. See, telemedicine and telemonitoring. Smartwatch. I think many of you are wearing the smartwatch. Oh, something is going on wrong. Sorry. Today, there is a problem with the electricity in the campus. So, telemedicine, telemental health. This is also a very important way because nobody likes to disclose their mental issue because of the stigma. So, telecounseling session, consultation, follow-up is very easy with the help of the telemedicine. Cross-border consultation without barrier to the country, no waiting time. See, this is very important. I can sit in my institute and I can provide the services to all over the world. And that is a very important scope and opportunity for the telemedicine at the world. So these are the new scope and opportunity. You can use, explore this, and you can try this. So with this, I think this is the last slide. Again, this is a second QR code I am putting here, and you can, with this QR code, you can check your immunity status. So these are the two tools which are made by myself. You can use them and you can check your things. Similarly, you can plan your own system for the telemedicine. With this, thank you. Giving the opportunity. Any question, query?
Thank you so much, sir, for the comprehensive talk. It was really very informative. And we have received few questions from the participating doctors. So, with all your permission, can I put them across?
Yeah, sure.
Yeah,
Definitely.
okay. My screen is visible, sir?
How can healthcare organization access the return on investment and cost effectiveness of telemedicine program in public health setting? This is very important question. Okay, so this is actually initially it is very difficult to give a real return on the investment. It is basically currently in India, whatever the projects going on, the project sponsored by under various CSR activity or government sponsored, but there are model people have started. That is a subscription model. You can take a subscription of your client. It is very difficult to get a subscription based on the model in the village area. But I have an experience. I had experience. We have started one scheme in my alumni college. That is a health assurance scheme with the Krupa scheme. Our institute has started and we charged that time 90 rupees. It was in the 2005 and 90 rupees for the whole family health coverage. So initially people were registered, but later on people are happily to give the subscription and they are joining to their scheme. So it's difficult. You have to create the demand, and after creating demand, people definitely will join. Okay, if I ask you or somebody, are you ready to pay an insurance amount or you can have a premium amount to be a healthy for the next 1 year? Nobody like to say. People are interested to listening that if I get ill, I should be treated free of charge in my hospital, any hospital. This model is currently going. But I am continuously be healthy for next 1 year and I am ready to pay a insurance amount, premium amount. And that is a new challenge upcoming. And that is the public health challenge. I think will come in the market very soon. And will be a various model will come for the ROI also, cost effectiveness also. So don't worry. It's very soon you can get a benefit because lot of doctors practicing telemedicine with the help of the even simple WhatsApp. And clients are paying through the, you can say, Paytm, Google Pay, or anything. So it's already in the ground. People are getting the benefit and earning also. So don't worry. Soon you will get a various model. And more detail we can discuss case by case. Thank you. What are the potential legal and liable issue in the telemedicine? How can we healthcare providers protect themselves and their patients? See, last session, I displayed that link, and that link saying that Ministry of Health and Family Welfare already released a guideline. So you can go and visit that guideline, and it is clearly government is supporting telemedicine concept. So I think don't worry. You can take an opinion. You can read first guideline. You require a specific question, but there is no major issue in legal aspect. you can definitely go without any major hurdles. So no major legal and liability, both rights of doctor and patient protected with this new guideline. You can read and discuss anytime next. Thank you. Next question.
Thank you, sir. Thank you so much for answering all the queries of the doctors. And I would also like to thank all the participating doctors also. And once again, thank you, sir, for your valuable time. So we hope to have you again on our platform very soon. Thank you, sir. Have a
Thank
nice day.
you. Thank you.